Good evening, Dr. Divala, and welcome to the show.
Good evening. Pleasure to be here with you.
I am particularly honored that you found the time. You're really very busy these days, and as somebody who follows Malawian politics and society, I of course read the major newspapers every day, and you've been on the front pages, and you've been one of those most well-known researchers and one of the most public faces in terms of the government response combating the COVID pandemic. And what intrigued me was your latest assertion or claim. And perhaps we should do a little bit of a background. I mean, Malawi has, of course, fared pretty well relation to, I mean, compared to what a lot of people had feared in relation to the COVID pandemic. But
Exactly.
in the last week or so, there's been a major spike. And what has been particularly alarming, I suppose, is that you've had two very high level politicians, cabinet members passing away, unfortunately. And this has created a state of national disaster. And there's a lot of talk about how this is spreading. And I noticed that you had a piece recently where you said that this new COVID-19 is not a second wave, but a new epidemic altogether. So could you please explain that and give us a sense of what the situation is in Malawi at the moment?
Thank you. Well, we had COVID-19. Our very first case was on 2nd April 2020, and we went through that wave. And most cases, hospitalizations and deaths occurred between June, July, and August, with a peak at the end of July. And then we had quite a decent amount of break until at the end of 2020, in the final weeks of December, when we started seeing a new spike of cases. The initial wave was very mild, I must say. We lost some people, very difficult, but it was 185 deaths. I must say that at the end of the year, the total number of people who had died by 31 December was 189. This is by no means comparable to sadly what many nations on the planet have experienced. But from the 1st of January to now, we have lost 96 people. And that's a very short space compared to the period where we've experienced 180. In just 15 days, we've experienced nearly 100 deaths. That's really huge for Malawi. In terms of cases, we have so far as a country recorded 10,000 cases. Our testing capacity is that low. It's not that Malawi has 10,000. Malawi should have millions of cases by now. But then the ones that the government has managed to work and record are 10,000. 4,000 of those, in other words, I should say, 4,000 of those have been recorded in the past 15 days. So this rapid rise, rather, is what has been problematic.
So we'll get back to this recent situation, but let's go back a bit to March and April of 2020. I was telling you before we started the recording that I returned to Norway on the 12th of March, which is when we actually went into lockdown. It was the last day. But, you know, I had the pleasure of spending my usual 3 weeks in Malawi in February and March. It was a wonderful time. The weather was great, except that there was much more worry that things were actually pretty bad in Norway and in Europe, but it wasn't that bad in Malawi. And then the discussion was all about, you know, what would a country like Malawi do because of the state of the healthcare system, because of underfunding challenges? What and how capable was Malawi to respond to the crisis? And this was the time when, globally there was all of this concern about Africa. Usually the concern arrives whenever there's a big crisis. We forget about these during normal times, which is pretty bad in any case. But there was this concern that, my God, if Asia is struggling, if India is struggling, if Europe is struggling, the US is struggling, Africa is just going to really struggle. So I wanted to to get you to please reflect on what explained the relative success, as you were saying earlier, until say December, when you just had less than 200 deaths. What was it? Was it the closure of the borders? What explained this success? Because in the international discourse, people are really dumbfounded. They can't really they can't come up with a good explanation for Africa's or the African continent's relative success until recently.
It is something that remains difficult to explain in many ways. There are such elements of effective response. Governments in this region sort of coordinated somehow and worked tirelessly to see to it that the region does have some way of defending itself. But also we do, as a continent, have a lot of experience with infectious diseases, because that's the bulk of what really kills our population. And this might have been one of the reasons for the low mortality. And there's that school of thought that says Africa succeeded, Africa did very well. But also there's probably what should be a bigger reason is the biological explanation that the numbers that we saw are far too low to be explained by institutional or rather response success alone. So most likely there is a biological reason, which may mean that either the population had some level of protection by the time the virus was getting to them, probably because of other environmental exposures, which make our bodies generate some form of protection against this very virus. And probably it could also just be that because of the lower numbers of there's low traffic into Africa in general from the rest of the world. So that may mean that we had lower numbers of people who were infected getting into the continent. Therefore, the transmission was far slower.
And I've heard that explanation, particularly in relation to Malawi, which is a landlocked country. And, when the airports are closed and the borders are closed, you become fairly insulated. But I wanted to ask you before we proceed, further, there's always been this kind of uncertainty in relation to statistics in many parts of the world. I mean, you don't really know whether these numbers are accurate. But given that you've headed the fight against this disease in many ways in Malawi, are you comfortable that the numbers before the recent spike that you were talking about, less than 200 deaths, is that a reliable number?
I can say for sure that it is not complete. We must have missed a number of deaths. I'm saying a number of because I don't think we missed a lot of deaths. Mm-hmm. You can miss recording cases easily, and you can miss recording COVID-19 deaths. It's possible. But what is difficult to miss is the large number of potential hospitalizations that we expected.
Right.
That is difficult to miss because people will still come out of their homes and present to facilities. We never saw that. Right now, with the new wave, you can see a complete contrast. Huge numbers coming into facilities.
That's a good point. So the very fact that people will seek medical help.
Exactly.
If they need that, even if they're in the most rural, remote parts of the country. Okay.
They will do the best.
I read this fascinating piece, the short piece you wrote in the Lancet last year, together with some of your colleagues, about this issue that a lot of people, including me, we are concerned with, is this copy and paste kind of policy measures that African governments, some African governments, or many actually, implemented. They basically copied a lot of what other countries were doing and applied these very strict lockdown measures within their territories. And you, in this article, together with your colleagues, you argued that those measures will not always be very appropriate, that one has to think of the local context. And I have a colleague at Stanford University, Paul Wise. He's been making the same argument that, because of the informal sector, because of the informal economy, you can't really have this kind of clamp down. And so, and I remember, during, I think it was around April, May, even in your country, there was a lot of discussion whether, this kind of a lockdown should be implemented. And then I think in the end, there were some constitutional issues that you have to actually have issued a state of national emergency for that kind of infringement on personal freedoms to take place. So if you could please tell us a bit about what you believe are the appropriate measures when one faces this huge challenge? Because obviously, from a medical point of view, I'm sure as a medical doctor, you would want, quarantines and very sort of strict regulations of social distancing, etc., enforced. But that is not possible, is it, in a country like Malawi?
Well, that's a good thing about public health. So we do go beyond just the medicine. And what medicine says, you have to think of the social context as well. So what we have been advocating for is a response that deals with the epidemic, but does not forget the rest of the problems. So there's huge potential for collateral damage should we focus only on the epidemic.
But how can we balance these two kind of concerns?
It is not the easiest of things to do, because if you can see how to manage COVID-19, the best well-documented measure is physical distancing. And physical distancing, really, the best way of doing it is stopping all movement.
Exactly.
If you stop all movement, you suffocate the people who are day wagers, essentially most of our.
And you can make things worse, right? You can, people would go hungry.
Exactly. So our thinking is that by locking down, stopping all movement, what you do is you increase mortality way beyond what COVID-19 can even achieve.
So what, in hindsight, could your country or many others in the region have done differently?
Well, Malawi did not implement a lockdown. Ideally, in this region, we should focus on the measures that allow a little bit of a balance between daily human activity and surviving COVID-19. So I can imagine the three most important measures of infection prevention: mask wearing, which should be universal and mandatory, and even going as far as reinforced by law.
But that's costly, isn't it?
I don't think so. If you do it from top down, yes, it's going to be costly. But if you do it from bottom up, so by bottom up, I mean engaging communities and transferring some of the epidemic management ownership to the community leaders. We have a very big difference with Europe. Back in Africa, life is real communal. We respect our local community leaders. If the chief says, in my village, no one moves around without a mask, no one
I know, they will respect the chief's decision.
Exactly. So one thing that has also helped to succeed in the Ebola crisis a couple of years ago was that kind of serious, well thought through community engagement. So you do that, you push these measures. We call them 3 Ws nowadays. Wash your distance, wash your hands, and wear your mask. Get that really seeded into the community and discourage traffic in and out of communities, except for essential activities, not necessarily reinforcing a complete cut from services outside that community, but discouraging traffic, especially from cities to rural areas. That
So
would be
what kind of masks are we talking about, Dr. Divala? Is it those disposable ones? Are we talking about the fabric masks? Because it is a matter of cost. Even in this country, a lot of young people or certain communities, they feel these masks cost a lot, and some people are also saying it's bad for the environment to just dispose of these masks. So how is the situation in Malawi? Do people use, I mean, have access to and can afford these one-time masks?
Yeah, so I must start by saying that the government of Malawi was one of the earliest governments to issue guidelines for making masks and guidelines for using masks. We produced our guidelines ahead of World Health Organization. So there are clear guidelines on how people from rural areas can do this on their own. But I must also say that if the government wanted to invest in that kind of policy, it's not difficult to really manufacture those. And I know there was several non-government organizations raised funds from Malawians and others outside and they were ready to distribute masks to 4 million Malawians, and Malawi is on 18 million, and these were just a few individuals. So I think it's possible. It's
And
not
China sent some supplies, did they not?
The Chinese government has also been very supportive of the Malawi government, and yeah, I have seen such donations. Yeah.
So I've been reading, as you know, I write a column in The Nation every Thursday, and I read the Malawian newspapers. And there've been all of these discussions of late that is it really possible to introduce social distancing in a minibus, which is cramped and there are lots of passengers, or even when I was last in Malawi in March of last year, I was giving a talk at Chancellor College, and it was a packed auditorium, and of course, the pandemic hadn't officially started in Malawi then. But I'm just thinking about, everything that I do in Malawi, shaking hands and doing the high fives, and it is just this way of touching, people, and one is often in close proximity. Is it, I mean, I'm just thinking it's a lot easier in this country, Norway, to maintain social distancing. We do keep our distance, but how
Mhm.
do you, as a researcher, as a physician, advise the authorities that they should advise the Malawian population to keep their distance? I mean, is it possible? I'm sorry if it's a stupid question.
No, not at all. It's the currency of life is interaction, and in Malawi we interact quite a lot. I mean, we come together, we have that social interaction on top of everything, really. But if you go to Malawi now, you see people actually practicing some of these measures. So what really drives people's practice of these measures is how you communicate to them. So if the government was to communicate carefully about all these measures, that's one way of getting the population to start practicing. You talked about public transport. Public transport actually complied for a long time.
Oh, really?
60% in a minibus. Not minibuses were never full for a reasonable amount of time, actually. And now again, going back to the same. So these things are all possible, but it also goes back to how much reinforcing you're doing. If you want to reinforce this using state machinery, it will not work.
And that is where I think you had a
That
really
is,
good point about the
yeah,
bottom-up perspective, right?
exactly.
Has that been applied? I mean, have the chiefs been encouraged to spread the message?
Um, Not officially. There are community engagement manuals that have been developed, but they were not really put into full utilization. I must say they came much later in the previous wave. So I suppose now those will be put into practice. If they are, I think we'll get off to a really good settlement. Because the good thing about COVID-19 is that whatever you're doing to protect yourself from COVID-19 does have benefits beyond COVID-19. We have other respiratory infections like tuberculosis, which I study as well.
Yes.
And all these actually, if you push the measures for COVID-19 beyond COVID-19, I don't nowadays, Dan, people don't shake hands anymore. They don't.
Which is a real shame if you ask me,
It's a
but
shame. It's a shame. But what I'm saying is these habits, some of them are going to stick. And so there's that health benefit long term. So hopefully, if we manage to get these measures out in a more organized bottom up approach, whilst the top down is happening for the short term, but long term, you really need bottom up. People need to take responsibility for their health
okay.
destiny.
So let's move on to this aspect of governance, which is my field. And I've
Of
been studying the state of Malawi for many years. And just to give you an example, I've been studying roadblocks in Malawi.
oh,
And what happens at the roadblocks, we know between two cities, and one gets stopped often. And the short story is my conclusion is that if you look good, if you look rich, if you have a good car, you're not stopped or harassed. But if you look poor, you get or a minibus driver, you get harassed. But we won't get into that. But my point here is that government in Malawi, or any government, any party that is in control, faces this problem of legitimacy, and credibility in many parts of the world. It's like, and this goes back to what you were saying about messaging. So my what I'm wondering about is, let's say you have a government, whichever party is in power, is saying you should be doing this and not doing that. It's not always easy for the population to agree. And I'm asking you this because in the last couple of days on Twitter, I've been seeing all kinds of Malawian analyses to some of these challenges, saying that in some of the villages, people don't believe that they could be infected. There's this idea that it only infects opposition party supporters, or there are all of these myths. And then it's not just Malawi. In other parts too, there's a lot of it could be superstition, it could be witchcraft. There are all of these things. So as somebody who's working from the medical kind of, from a scientific basis, how do you address these challenges? Because it's not just saying don't do this or wash your hands. And you're absolutely right, the Malawian government was exemplary. When I arrived in Malawi, they had brochures at the airport saying what we should be doing. I was super impressed. There were all of these taps, and hand washing suddenly became very common, which is fantastic. But how do you combat these other kind of suspicions, and when you don't trust the government, when state legitimacy is weak? Is it possible to impart scientific knowledge?
it is extremely hard. That's a quick answer. We struggled for a lot of interventions. Really struggle. If you say anything, so the problem with epidemics of this nature is that the non-pharmaceutical interventions are really difficult to do. So people always find excuses. First, let me say that, and two, if the burden is not too high, risk perception. People don't think they, as individuals, will will get the virus, for example. So the risk perception is far lower. So what I experienced in the previous wave is that we had a very difficult time. Power was not stable in terms of leadership. The progressive party leadership had lost most of the population along the way, and people wanted change, really hungry for change. And during that period, we got this epidemic, and really bad timing. And any health messaging was associated with the government. So it was a difficult thing to do. But when the disease started hitting hard, the risk perception went up. I must say I think it was timely in a way, but a little bit too late. I think if the risk perception was that high from the beginning, which is never the case in public health anyway, um, uh, yeah, we would have achieved a bit more. So really, it's a balance between how people view the messenger, in this case, the government, then, and the disease itself.
I think
So
that's a great point, and just to clarify for our viewers, Malawi had an election in mid 2020, which was court mandated. The 2019 elections were annulled, and there were new elections held. And I was one of those commentators. I was extremely surprised and pleased, of course, with the bold verdict. And I have interacted with several of the judges who nullified the 2019 elections. But I was also worried that elections during the epidemic would just not be possible. But somehow you managed it. And I mean, the narrative of Malawi, and I've been writing about this, has changed. I mean, the Economist magazine has ranked Malawi the country of the year because of progress in democracy, etc., because of a peaceful transfer of power. But you're absolutely right that it was the worst timing, because until, was it June, you had a government that was basically a lame duck government. Everybody was waiting for the elections to take place. So how can you listen to the government? But despite all of these challenges, Dr. Divala, you still managed to keep the number of deaths low.
exactly. So still a lot of things worked, and also the biological aspect, the fact that, or rather, I should be calling it the possibility that there was some level of protection or lower transmission in general, or infectious dose in the country. All these put together should be the reason for the low number of deaths. The rapid rise that we have seen now is consistent with the faster transmission of the new variant in South Africa.
That's what I was thinking. So,
So,
is that why
yeah.
you're saying this is not the second wave, but a new pandemic?
So the reason I coined in that figure of speech really is that we have an epidemic ongoing, an epidemic which by now we know very well. We know it. We knew a second wave was coming. We knew it was going to be in December. But what we expected, even I myself, I was expecting a similar epidemic to what we had back in June, July, August. But now what we got is a much faster spreading version of the same virus, and the hospitals filled up within 2 weeks. It feels like we have a new epidemic within an epidemic. We have a new outbreak, an outbreak of the new variant of the same virus.
Is it as simple as the fact that borders have opened and flights from South Africa coming in? Is that the reason?
Well, our border situation, I must say, comparing the first time and now, the border situation has not changed. The borders are closed to foreigners. Foreigners can't come into Malawi now.
Okay.
People who are coming into Malawi, Malawians returning from difficult lockdown situations, essentially from South Africa. And that's really the same situation back in May. From 18 May, I remember we got the first set of buses coming from South Africa. But the transmission, they were coming with high positivity rates. So
Mhm.
out of 100, you would get 20, 30 testing positive. This time it's similar. But the virus that's coming in now has a higher probability of moving from one person to the next.
What are your thoughts on vaccines and COVAX and because before Christmas there was this kind of euphoria in the West about how this is going to resolve things. It hasn't worked like that. In fact, 2021 has begun in a pretty depressive manner, even in Norway.
Sadly,
And
sadly, yes.
so I've been very pessimistic about this, and I don't see vaccines to be the immediate solution. But we are, of course, very lucky here that there are supplies coming in, and certain groups are being prioritized. But there's been this kind of a global discussion on how unfair this is, how the rich are just rich countries are just stocking up. They're ordering much more than they actually need, and many poorer countries are going to really face a difficult time. In recent days, of course, I've been told that the African Union has been able to get a lot of doses, etc. What are your thoughts on this kind of vaccine nationalism that has been taking place in large parts of the Western world?
I must say it's a symptom of uh, what the world is like. Global health is always political. Um, you never get a new intervention really easily. We struggle
Yeah.
with HIV. HIV is predominant in Africa, but for Africa to get HIV drugs at a good price, every time there's a new HIV drug, there has to be a lot and painstaking advocacy before we get that drug at a good price. So for vaccines, the same will happen. And it will be difficult for Africa to get enough doses of vaccinations. I'm pleased that there is the ACT accelerator team, um, uh, where, among others, there's COVAX. There's also a group on diagnostics and many other tools, whose philosophy is that for the epidemic to end, it has to end everywhere on the planet. So I really like that initiative. It does allow us to get a reasonable number of doses via that route, although it's going to take a little bit of time, I think, but still it's a good start. But long term, Dan, Africa has got to learn and perhaps try to march as fast as the world does march. What I mean here is that we need to invest a little bit more than we're investing now in our health system, in our infrastructure as well. We need to have more preparedness for some of these things. We need to also come to a level where we're ready to pay for some of these important facilities. It's very difficult to go there now because we are really far behind. But I think that's something that African heads of state have got to start thinking about.
A final set of questions, relates to India and China. And I have a new research project, and we're looking at India as the world's pharmacy and how India is, not just producing drugs, but also distributing them in large parts of the world. And you mentioned HIV, of course. The antiretroviral drugs from India have been very crucial in many parts of sub-Saharan Africa.
Absolutely.
How do you see that playing out? Because there's this, of course, China has been talking about its own vaccine. I just read recently that Brazil was reporting that it hasn't, it hasn't been as successful. I mean, as they had expected. So the rollout, one is not sure about the Russian vaccine, the Chinese vaccine, and India, of course, the Serum Institute is heavily involved. Do you see these two emerging powers, and through this kind of South-South cooperation, do you think that would be of benefit to the African continent in terms of accessing vaccines in the near future?
Uh, well, I'm not very qualified to comment on this, but I think African governments will go where their relationship is strong. That's probably the first criteria even before the science. Um, on the scientific aspect, the key is if the vaccine is performing well, it's okay to get it. And if the Indian vaccine, the Russian vaccine, the Chinese vaccine are performing as good as the other vaccines and are more accessible in terms of finances, I wouldn't discourage my government to go for it. And I would actually say those countries that are offering them at a lower price are our friends. They want to save us. So essentially, it's a possibility that we're going to go in that direction. But I would encourage governments to really look at not just the money, but also the science. Is a vaccine good enough?
Let me ask you a hypothetical question. Let's say today you had enough doses of vaccines available in Malawi. How would the vaccination process take place? I'm asking you this because in Denmark, in Norway, in many parts of the world, there have been a
Mhm.
lot of criticisms that countries just have been slow. I mean, they have the doses, they have all the logistical capacity. Even then, they haven't been able to vaccinate as quickly as they should have. How would that work hypothetically if you had that in Malawi? Would you, I mean, we're not talking about the Pfizer vaccine that requires this extremely low temperature and storage. Let's say you have the ones that don't do that. I mean, would
Like the
you, would
Oxford,
you, would
yeah.
you have, would you be able to do this quickly in Malawi?
I must say that this is where we are strong.
Hmm.
We deal with infectious diseases all the time. We have what we call the expanded program on immunization. This program vaccinates nearly all children in the country, and the vaccinations happen annually. So I think we are one of those countries that can vaccinate really rapidly. We have a week, we call it the vaccination week. We call it
Hmm.
Child Health Day, but it's like a whole week. Each district does the vaccinations for children in that entire week. So because of that long-standing experience, and also the population is used to vaccinations, because of those two things, we should not have problems distributing the vaccines.
And you
But
won't have problems convincing people that this is safe and stuff?
no, this time around, I mean, there are a lot of sources of information. Uh, but the key really is how you communicate. You have the vaccine and you know it's going
Mhm.
to save lives. It means you've got to have to invest a little bit more in your communication to the public. You do a good job, then you counter all these misconceptions as much as possible and get the vaccine out there.
But it seems that you're communicating really well, Dr. Divala. You're in the newspapers, and I'm sure you're on TV. What else can you do?
Well, I'm always criticized. People always have their comments on whatever I say. It's
Why?
That's just about it. There are always two sides, and people.
What
Uh,
are the criticisms?
the criticisms are usually about for example, right now we're talking about schools. Everyone wants schools. Well, most people want schools to close now. Uh, some people want schools not to close. And I'm saying, well, have we exhausted the basic measures? Are we applying the basic measures before we go to something that's a little bit more harmful as closing schools? I'm saying if you want schools to remain to close, are you sure you're wearing a mask everywhere you're going? Because that's the first step.
Yes.
But when you say that, people come back and say, "Oh no,
But
we should."
believe me, this is the same debate we've had in Norway and all other parts. Some people want total lockdown, some people want to minimize the effects. And if I understand it correctly, you've been one of those saying we have to be measured, right? You can't
Yeah,
just have this kind of dictatorial, totalitarian lockdown.
exactly.
People have to live a life. I'm sorry I've kept you up so late this evening. My final question is, how do you see this play out, not just in Malawi, but also in neighboring countries, in South Africa? Give us a sense of what the optimistic take, if that's possible. what do you think can happen in the next 5 6 months that will really, help combat the further spread, even of this more infectious variant that you were referring to from South Africa?
Um, I think um, in general on the African continent, my country and our neighboring countries, we are going to go through another period of difficult weeks, maybe several weeks from now. It's going to be difficult, and then it's going to go down again. Um, the hope, though, is that our most vulnerable in terms of risk of mortality should find a way of getting protection. Should we get the vaccine, um, this is the time to get those people protected. Should we not, we need to find a way of ensuring that they are somehow protected as a population. We need to find that way. So really, I don't expect a very big epidemic. The numbers that we're seeing now are really bad, but then they're not the worst of the numbers. I'm just saying this because I'm just looking at numbers. I know each individual is important, but just looking at the numbers overall, I do not expect Malawi to have a very big burden. I don't expect any African country to have a very serious burden. But how we manage the population this time round, as we're going through a more serious epidemic than we did first, will determine whether should we have another wave. We're
Right.
going to have less than what we lose now, because we had the first wave and then there was a 3 months period.
Mhm.
Now we have another wave. There may be another wave 3 months from this current curve that's rising now. So we need to make sure that this time around we are arming ourselves as a country, getting as much information out there, and not just information, but also responsibility, transferring to the citizens as much as possible. People should get to understand and move forward. Overall, I don't see a completely collapsed system. I don't see, I see a reasonably harmed or well harmed economy. That will happen. But in terms of numbers, I think a lot of people will go through, uh, and I hope that will happen. Um, and the way governments come together in the region also has a huge impact, because in the first wave we struggled at the beginning. Governments were not talking to each other,
Mhm.
and later on governments started talking to each other. If South Africa will talk to Malawi really well, and citizens who are returning to Malawi from South Africa are being handled better, that's one type of problems closed. So that kind of engagement, with time, the systems are learning now will get better.
My take on this is that the two things. One is I really hope, and I've been, promoting this idea that we should be also highlighting what works in development rather than all the stuff that doesn't work. And I think this is a great case of maybe highlighting, maybe later on in hindsight, we'll realize that the African continent, well, because of maybe prior experience with Ebola, maybe prior experience with other infectious diseases, was perhaps well prepared, that maybe some of those warnings were misplaced, those doomsday warnings. And I think we should better appreciate, given limited resources, what many people like you have been able to achieve. So I think that what work story, I hope, comes out. The second aspect, I hope, in
Exactly. I
many.
would like to agree with you on that, because COVID-19 came just after we had concluded that Ebola is not coming to Malawi. In the period just before that, we mounted Ebola preparation sites, lots of sites across the country. And we then used the very same sites and the very same staff to manage COVID-19.
Right.
So indeed, the experience did help, and it's really going to be part of a good story that we can tell in the future.
And the second and final aspect, I think, for me is that I hope this sounds some sort of a warning bell, for the fact that we really need to invest in primary healthcare, in basic healthcare, and not just wait for these crises. For many years, my work has focused on how, hunger, regular hunger, is not seen to be a problem. It's only when it becomes a famine and thousands of people die that the international community, reacts. So I hope that funding for during normal times is strengthened, and we're not just waiting for the worst case scenarios. So
I think
that
that
is at least my, I don't know what you think
no,
of
no,
that.
I completely agree. There, you actually make a strong point as well, because of poor investment, we even struggled to deliver oxygen to the few sick people that we had in the first wave. Better off this time around, but unfortunately, this time around, we also don't have enough hospital beds. And
Exactly.
when we say we don't have enough, it's not like I'm saying we don't have 1,000, talking hundreds. So we really need, we should have had all that by
How
now.
many respirators do you have?
You mean ventilators?
Ventilators, sorry.
I don't think we can reach 100 for the whole country. It we are lucky that we haven't had uh, that many numbers
I
demanding
see.
the service, but we really haven't invested much, in our health system enough to relative to the time that we've been, I should say, independent as an independent state. We should have had a larger budget for health in general, but also even this time around, we knew there was COVID-19. We had an idea that second wave was coming. The budget that was passed recently, well back a couple of months ago, should have included a substantial amount of preparation for a second wave, but that did not happen. So this is a wake-up call to people in leadership positions across the continent to consider investing in health. I know you've talked about international support being there even in good times, but I would also say even our local governments, they should also consider investing in primary care. They should invest as much as possible in preparedness for outbreaks. This should be a constant feature because these outbreaks will always come. They will always be there. So we need to show that we know that they will come and we are ready for them.
Dr. Divala, it was such a pleasure speaking with you this evening. I've been highly impressed with your work, and I wish you the very best as you tackle this new epidemic, and or the new wave, or whatever you wish to call it, in the next few months. And I look forward to speaking to you maybe a few months down the line, where you will hopefully say, this was the reason why we succeeded, and highlight all the stuff that worked. So thank you so much for speaking with me this evening.
Thank you so much for making the time. And really, whatever you see is a product of a lot of health workers who are on the ground as well, who are pushing their effort in every day, even when at the time when the country was never understanding what COVID-19 was, how much effort was going into, health workers were on the ground working hard 24/7, even as we speak. So yeah, thank you. It was great being here. Hoping to speak with you again in the future.
Thank you.